Welcome. Today we're going to talk a little bit about the way that insurance works. We're going to talk about some of the basic mechanics, some of the fundamental vocab, and other things that you might need to understand to see a little bit about how this area of law functions. So let's start that out by using a simplified example, a hypothetical. Let's say that you're a big wrestling fan. As a big wrestling fan, you may share a concern that many wrestling fans have about coming down with a serious case of Hulkamania. Now, if you were to come down with Hulkamania, the primary concern you might have is what effect this is going to have on your clothing budget. So for the sake of argument, let's say that this would add $1,000 a year to your wardrobe budget. If this is $1,000 you can't afford to spend, this is a significant concern. Let's add a further detail that says that 1 in 10 fans of wrestling will come down with Hulkamania in a given year. So this is a significant risk that you're undertaking by being a wrestling fan. So how do we deal with this risk? Really, this is what insurance is all about. How do we deal with risk? So in this case, what you might do is find, let's say, 9 other people, right? Between these 9 other people, again, for the sake of argument and for the sake of the example, we'll say exactly a 1 in 10. So if you've got 9 other people, 1 of the 10 of you every year will come down with Hulkamania. And let's say for whatever reason we know it's exactly 1 in 10. We're not going to have a year where a couple do or a year where no one does. Exactly 1 out of the 10 of you. You don't know who it will be, but 1 out of the 10 of you will get Hulkamania every year. Now, it may not be you, right? We may be happy with that situation, or it may be you. But what you do by joining together with these other 9 people is you divide up the cost of how much it's going to impact you to have this extra expense in a year. So in this case, by dividing it by 10 people, you're actually only going to pay $100 a year. So this is really what you do in insurance, right? In this case, you're trading the known risk of spending an extra $100. You know you'll spend an extra $100 a year to protect against the unknown risk of having to spend $1,000 in a year. And of course, if you don't know who it's going to be year to year, it could be you every year, and you may save a lot of money with this. At the same time, it may never be you out of these 10 people, and after 10 years, you've actually spent more money on the insurance than you did on we would have had you not taken the insurance. And this is part of the nature of, I guess, the game or the bargain that takes place in the way that insurance works as well. But this is a very simplified example of how it works. And let's take a little bit of a deeper dive looking at the mechanics themselves. The thing we were talking about when we talk about you finding those other 9 people is something called risk pooling. Now, risk pooling is the fundamental mechanic of insurance. And what it really says is on one side of the scale, we have this thing called risk. And on the other side of the scale, we have the premium. The premium is the amount of money you pay to buy and maintain an insurance contract. And what's essentially going to happen here is every time the risk gets a little heavier, the premiums are going to go up. So we press down on the one side in the scale, the other side goes up. So heavier risk means higher premiums, more cost. So what are some things that drive up a higher premium? Let's think of the example of maybe health insurance. Adding unwell people, so people who are already a higher risk of needing to receive benefits, in other words, expenses, coming into the insurance plan, will raise the costs. Increasing the cost of care, in other words, as providing the care that people need becomes more expensive, so too do the premiums. Or providing more extensive coverage. In other words, if you have to cover a wider range of, say, diseases than you used to have to, that would have a significant effect on the premiums that are charged for this insurance. At the same time, if you were to add more healthy people or people who are less likely to use the services, less likely to need coverage, these people will actually help to lower the premium. They'll take on a bigger share of the risk that you're pooling around with everyone else. Greater certainty can also lower the premiums. In that simple hypothetical that we used, we had a very certain example. We knew that exactly 1 in 10 people, and that it would only be 1 in 10 out of a group of 10 people, would come down with Hulkamania in a year. So applying that here, if we had that kind of certainty, we would know exactly where to set that premium. If we didn't have that certainty, then you have to say, okay, well, what about a year when 3 people get it, or a year when nobody gets it? And you're going to have to set the premium in a way that protects against that risk and make sure that there's still money in the pot for everybody, if it happens to be the case that you have a year where there's a lot of claims or a year where there might be no claims. And that's really where all the math comes in, and a lot of the other things that go into making insurance so complex, is dealing with that certainty aspect. And finally, you may be able to control your risk in some way by adding stop-loss measures. So let's say with that Hulkamania example, you could come down. It's a 1 in 10 chance of getting it. You could get it twice in a year. If the insurance were to say, we only cover you for once in a year, it would protect itself against that extra $1,000 of costs that might come up if you had to cover somebody for a second year or a second occasion in the year. And so then really the way that insurance is working here is lowering the risk, lowering the exposure that the plan has to having to pay out benefits, and thereby lowering the premiums you have to pay. So I've used some of this language of premiums. What kind of insurance, what kind of a plan does this buy you? And let's look a little bit about how you spend money as part of an insurance plan. So let's look at some of the key vocab here. This graph is really assuming health insurance. Health insurance is our sort of model example for this. So everything in red here is something where you're paying, everything in blue is something where the insurance company is paying. So let's look at some vocab. You may have heard about hitting your deductible before. Your deductible is the amount of money that you need to pay before the insurer starts to cover your costs in an insurance plan. This is not what has to be paid before you're covered. With something like health insurance, what often happens is that the insurer also negotiates specific prices for the care that's being provided by the doctor, say, that you go to visit. That doctor might charge a different rate to somebody who was not insured. And so you are covered by it. In other words, you're paying the insured price, but you're the one that's bearing that expense until you hit your deductible. After you hit your deductible, then if your insurance happens to have something called co-insurance, and not all do, but if you happen to have co-insurance, then what happens is you divide up your costs after that until you hit a certain point. That certain point is called the out-of-pocket maximum. So let's look at an example of how that would work. Let's say your out-of-pocket maximum was $7,000. And let's furthermore say your deductible is $1,000. So after you had spent $1,000 up front on your own care, then your insurance would kick in paying for its portion. Let's say that it's a 70-30 split. They would call that 30% co-insurance. What that means is you have to pay 30% of every bill after you hit your deductible. You pay 30% of every bill until you hit that $7,000 mark. What that really means is there's another $10,000 in care essentially built into that. In other words, by the end of the day, you've got, $20,000 in care. Once you've had $21,000 in costs total in a year, then you will have hit your out-of-pocket maximum. You will have only paid $7,000 of it, but at this point now the insurer will pay everything. And the insurer will pay everything up until you hit the amount that's called the annual maximum. Now, this isn't as relevant to healthcare as it used to be. Back in the old days, this was a more common feature of health insurance. Since the Affordable Care Act, this is actually for most services that you would need, hospital care, a lot of your primary care and disease care things are now not able to be subject to an annual or a lifetime maximum. In other words, these sort of stop-loss measures have been removed from insurance. They were viewed as being undesirable for certain policy reasons. And so those have been removed. And generally that means the insurer is on the hook. Once you hit your out-of-pocket maximum, they'll pay everything. Another thing you may have heard of in the world of insurance is something called a copay. A copay is totally separate from this whole little chart we're looking at here, this little bar. And really you shouldn't think of them as connected. I know it gets confusing, copay, co-insurance, but a copay is just a flat fee for service. And the way a copay is supposed to work is, let's say you go to a doctor's office and you have a $30 copay. Just for walking in the door, you have to pay $30, and this does not contribute towards your deductible or your co-insurance. The purpose for having this $30 is, the idea is, let's say you have the sniffles. Now, if you think you just have a minor cold, you may take some NyQuil, drink some 7-Up, go to bed. or you could go to a doctor. Now, if it costs you nothing to go to a doctor, you may be more likely to go to a doctor, something that could drive up the cost of providing medical care, something that drives up the cost eventually of your insurance. However, if you know it's going to cost you $30 to go talk to your doctor, and you just have a minor case of the sniffles, you may just take that NyQuil, drink your 7-Up, and go to sleep. And so it's really a way to help people control the costs of care, and really functions by a totally different mechanic than this sort of cost-sharing structure that we're talking about here with the deductible co-insurance and all of that. So really looking through this is really the fundamental way that insurance works. These are some of the fundamental vocab things you need to be aware of to understand the language that comes with insurance, although there are some special terms that also come with different types of insurance. But hopefully this helps you, give you a little bit of an introductory view of the type of things that will help you understand this area of law a little bit better. Thank you.